In the midst of a pandemic, it may be easy to forget about the importance of getting your annual flu shot. Influenza, known as the flu, and COVID-19, the illness caused by the pandemic coronavirus, are both contagious respiratory illnesses, meaning they affect your lungs and breathing. Although the symptoms of COVID-19 and the flu can look similar, the two illnesses are caused by different viruses. Lisa Maragakis, Senior Director of Infection Prevention at Johns Hopkins, explains how the flu and COVID-19 are similar and how they are different.
First, let's start with the similarities. Both diseases can cause fever, cough, body aches, new onset fatigue, and congestion or runny nose, sometimes vomiting and diarrhea. The full list of symptoms of COVID-19 continues to evolve as more is learned about the illness. Both can be either mild or severe, and even fatal in some cases. Both can be spread through droplets in the air from an infected person coughing, sneezing, or even talking. Both diseases can be spread by an infected person for several days before symptoms appear. Both are treated by addressing symptoms, such as reducing fever. Severe cases may require hospitalization and even support, such as mechanical ventilation. Both diseases may be prevented by frequent, thorough hand washing, coughing into the crook of your elbow, staying home when sick, and limiting contact with others who are infected. Physical distancing and wearing a face covering or mask can also limit the spread of influenza and COVID-19 in communities. The first main difference is the cause behind each infection. COVID-19 is caused by one virus, known as the Severe Acute Respiratory Syndrome Coronavirus 2, or SARS-CoV-2. Influenza is caused by any of several different types and strains of the family of influenza viruses. It is worth noting that the symptoms of patients with COVID-19 often include the loss of taste or smell, and this is not a symptom that is typically associated with influenza. While both influenza and COVID-19 may be transmitted in similar ways, data show that there is a possibility of COVID-19 being spread through the airborne route, meaning that tiny droplets remain in the air and can cause disease in others even after the ill person is no longer near. No vaccine is currently available for COVID-19, though development and testing is in progress. A vaccine is available and effective to prevent influenza, particularly some of the most dangerous strains, and this helps to reduce the severity of the flu. Lasting damage to the lungs, heart, kidneys, brain, and other organs is possible after severe cases of COVID-19. Influenza can also cause complications such as inflammation of the heart, brain, or muscle tissues, and multi-organ failure in severe cases. Patients sometimes develop secondary bacterial infections after influenza infection. The first cases of COVID-19 appeared in China in late 2019, and the first confirmed case in the United States appeared in January of 2020. The World Health Organization estimates that 1 billion people worldwide get influenza every year. Doctors and scientists continue to work to quantify exactly how deadly COVID-19 is. At present, it is believed to have a substantially higher risk of death than influenza. It is imperative this year that each of us get an influenza vaccine to protect ourselves, our loved ones, and our community.